My name is Valérie Briand, and I'm a medical epidemiologist specialized in malaria, and I'm the head of the research department at Epicenter Médecins Sans Frontières in France. Epicenter is the sponsor of the IMVACS project. Malaria is still one of the main causes of illness and death in children under 5, especially in areas where transmission is highly seasonal, like in the Sahel. We now have the R21 Matrix M malaria vaccine, which has shown strong effectiveness in clinical trials. It requires 3 monthly doses for the primary series and then a booster 1 year later. Currently, R21 is mainly delivered through routine immunization services, the EPI. The EPI is essential, but this strategy follows a strictly age-based schedule. As a result, some children receive the vaccine after the peak of transmission, while others receive it well before, with the risk that its effectiveness may wane just as the rainy season begins. A fixed schedule, therefore, does not guarantee optimal coverage during the rainy season. In addition, the EPI does not always reach all children, particularly those living in remote areas. In practice, in many high-burden settings where the vaccine is being implemented, coverage and protection remain below desired targets. Many children don't receive their full protective 3 doses of vaccine, and even those who do may not get them at the right time, with an impact at individual and community level.
Hello, I'm Lise Deneux. I'm a senior clinical epidemiologist at Epicenter. I have expertise in infectious diseases clinical trials, and I'm the coordinating investigator of the IMVACS trial. This is actually exactly the kind of operational and programmatic challenge the IMVACS trial is trying to address. The study compares 2 ways of delivering the R21 vaccine, through routine EPI and through seasonal malaria prevention campaigns, SMC, targeting children under 5 in areas of intense seasonal transmission. By integrated vaccination with SMC, which already reaches large numbers of children during the malaria season, we want to see whether this approach can improve coverage and better protect children under 5 against malaria. IMVACS doesn't just look at effectiveness of the vaccination. We also assess how acceptable and feasible this strategy is, how much it costs, and whether it's relevant for national programs. The goal is really to provide practical evidence that ministries of health and policymakers can use when deciding how to roll out malaria vaccines.
Good morning. My name is Kasum Kayantao, and I'm a professor at University of Science, Techniques and Technology of Bamako in Mali. I'm the principal investigator of the IMVACS project in Mali, and my research focuses on prevention on strategies of malaria in pregnant women in children under 5. The primary objective of the study is to assess the non-inferior effectiveness of integrating seasonal malaria chemoprevention with the R21 vaccination strategy compared to routine API vaccination, but we will also explore the broader impact of other malaria prevention strategies. In Mali, the IMVACS trial started by conducting a census of the entire population across the different clusters to have a good estimate of the target population to allow an efficient planning of activities from logistics and equipment to staff recruitment. Our stakeholders were also engaged at every level, national, regional, district, and community to ensure support of the study. Our awareness campaigns were carried out through meetings and radio message. Vaccination started from June to December 2025. During that period, we were able to vaccinate with the 3 primary series of vaccination more than 5,000 in the children in the control arm and more than 10,000 children in the intervention arm.
My name is Mahamadou Dambele. I'm a medical doctor. For this study, I'm in charge to coordinate activities in the field, precisely in Mali side for Joila. The main focus for the next step is the administration of the booster dose to children who have received the first 3 vaccination doses. This is scheduled for early June in our control arm and July 2026 in our intervention arm, along with the first campaign of SMC. Prior to the administration of the booster dose. Community sensitization campaign will be held, and we plan to train our field worker.
I am Associate Professor Natama Magloire from the Clinical Research Unit of NANURO. I am a biologist by background and expertise in the field of malaria vaccine trials and also malaria genomic surveillance. Within the IMVACS project, I am the PI of the Burkina Faso site and the scientific leader of the consortium. The IMVACS trial in Burkina Faso is conducted in the health district of Boussé across 20 clusters corresponding to the catchment area of peripheral health facilities. In the control arm, 10 clusters deliver the R21 vaccine through routine EPI to children aged 5 to 36 months following the standard age-based schedule. In the intervention arm, the other 10 clusters implement a seasonal delivery strategy where the vaccine is administered through the SMC platform, targeting children aged 3 to 59 months. A door-to-door approach is used to reach children directly in their home and administer both R21 and SMC during each SMC round.
I am Serge Woba. I am a research associate at the Clinical Research Unit of NANURO in the field of epidemiology, and in the IMVACS trial, I am managing the field activities. Enrollment in the study was conducted between June and December 2025, and children in the intervention arm received their primary 3-dose series during the 4 monthly SMC rounds from July to October. To date, 3,266 children have received at least 1 dose of R21 in the control arm and 6,231 in the intervention arm. Implementation of the trial activities, including community engagement, has been successfully carried out. No serious adverse events related to the intervention have been observed so far. We continue to follow the children and document malaria episodes and safety outcomes to generate robust policy-relevant evidence on the effectiveness of this delivery approach. The booster dose administration has started in April 2026 in the control arm and will be administered in July 2026 in the intervention arm during the first SMC round.
Hi, my name's Eve Worrell. I'm a Professor of Health Economics from the Liverpool School of Tropical Medicine, and I lead the Health Economics workstream on the IMVACS project. When resources are scarce, it's important to ensure that we use them carefully to gain the maximum possible impact on health. This is why we are doing economic studies to evaluate which delivery strategy has the most impact on malaria for each dollar spent. To do this, we will carefully measure the cost of both delivery strategies, including the costs to health system and to the families and caregivers of children receiving the vaccine. We will also look at how effective each strategy is at preventing malaria, using the data from the cluster randomized trial. By comparing both the costs and effects of each strategy using a method called cost-effectiveness analysis, we will be able to provide recommendations to policy decision makers in the trial countries and across Saharan Africa on how best to deliver the malaria vaccine.
Hello, my name is Jenny Hill and I'm a professor at the Liverpool School of Tropical Medicine in the UK. My research focuses on malaria treatment and prevention strategies in vulnerable populations such as pregnant women and young children. And I'm the principal investigator of the social science studies nested within the IMVACS trials in Mali and Burkina Faso. Through interviews and focus group discussions with parents and caregivers, vaccination and SMC staff and community members, our team will assess how acceptable and practical the 2 vaccine delivery strategies are in the real-world setting. By delivering the malaria vaccine alongside SMC, which has a high degree of success in terms of coverage, we believe that the integrated strategy will increase uptake of the malaria vaccine and improve equity. SMC is an established strategy delivered by community health workers who are trusted by caregivers and health providers alike. By bringing the vaccine closer to the community, we aim to increase access to the vaccine among hard-to-reach populations that do not currently access immunisation.
by listening to community voices, taking their concerns, preferences and suggestions into consideration, we can help identify which is the most appropriate and acceptable approach. Incorporating community viewpoints is essential, not only for improving vaccination coverage, but also for building trust in vaccination programs.
Hello, my name is Kajatu Kuita. I'm a research associate at the Parasites and Microbes Research and Training Center at the University of Bamako, Mali. I'm the lead of the qualitative study of the IMVACS project in Mali. Even the most effective interventions have limited impact if they do not reach those who need them the most. In many rural and underserved areas, access to health facilities can be difficult due to distance, poor roads, or lack of transportation. As a result, some children may miss routine vaccination opportunities. By delivering the malaria vaccine through community-based approaches like SMC, the IMVACS trial brings vaccination services closer to families. This integrated strategy has the potential to improve access and ensure that more children benefit from this life-saving intervention.
Hi, this is Dario Scaramuzzi. I'm the director of Revolution Worldwide, a scientific not-for-profit organization focused on biomedical and public health research. I'm also the coordinator of IMVACS project. IMVACS aims to provide clear, practical evidence on how best to deliver the malaria vaccine to the children who need it most. By combining scientific, economic, and social insights, the project supports countries in making informed, effective decisions. Our goal is not only to improve vaccination coverage, but also to ensure protection reaches children at the right time, ultimately reducing malaria burden and saving lives.